Hi, I am Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. I am pleased to introduce 4 excellent papers from the 2021 July issue of the Journal of Vascular Surgery. Each are freely available to read or full text download for the next 2 months. Our Editor's Choice article this issue is Update on Workforce Diversity in Vascular Surgery by Dr. Chelsea Dorsey and colleagues from Chicago, Illinois and Stanford, California. This study compared the proportions of females, blacks and Hispanics in vascular fellowship, in vascular surgery, in general surgery and orthopedic surgery residencies. Between 2013 and 2017, 36.7% of the vascular surgery residents were females, 7.3% were Hispanic, and 5.1% were black. In vascular surgery fellowship, the same proportions were 27%, 8.7%, and 5.4%. There was a significant increase in the number of women and Hispanic trainees, but there was no significant change in the proportion of blacks who entered vascular surgery fellowship. Hispanic trainees were well represented in all surgical specialties, but women and black trainees were underrepresented in all specialties as compared with their representation in medical school. These data suggest that the pool of women and underrepresented minority medical school graduates who are interested in surgical specialties needs to be increased. Our CME article this month is titled Society for Vascular Surgery Femoral Runoff Score is associated with limb-based patency after aortofemoral bypass. It was written by Dr. Charles DeCarlo and colleagues from Boston, Massachusetts and Charlottesville, Virginia. This is a retrospective review of the clinical data of 161 patients who underwent aortounifemoral or aortobifemoral bypass. Runoff scores were assigned from 1 to 10 based on occlusive disease in the superficial femoral and profunda femoris arteries, as described in the 1997 SVS reporting standards. Patients with low runoff scores had significantly higher patencies at 5 years than those with higher runoff scores. An SVS thigh runoff score of 6 or higher was independently associated with loss of primary limb-based patency. 5-year unadjusted patency was 68.8% for limbs with high runoff score and 86.7% with limbs with a low runoff score. The next article was written by Dr. Isaac Nazi and colleagues from La Jolla and Los Angeles, California. It is entitled Primary Mechanism of Stroke Reduction in Transcarotid Artery Revascularization. TCAR is dynamic flow reversal. In this VQI study, 8,426 patients underwent TCAR. 274 pairs of patients were compared after propensity matching. One group had dynamic flow reversal, the other had distal embolic protection. TCAR was associated with a significantly lower risk of stroke and death. The stroke was 0.4% versus 4%. The stroke and death was 1.1% versus 4.7%, suggesting the benefit of TCAR may be distal flow reversal and not necessarily just avoiding the aortic arch. The final article by Dr. Ghazi Harika and co-authors from Paris, France and Tulsa, Oklahoma is entitled Comparison of Surgical versus Percutaneously Created Arteriovenous Hemodialysis Fistulas. In this retrospective study, outcome of 170 patients who had ellipsis vascular access system, a percutaneous arteriovenous fistula, were compared with outcomes of 107 surgical fistulas, surgical arteriovenous fistulas. The percutaneous arteriovenous fistulas had superior maturation rate at 6 weeks, and surgical arteriovenous fistulas had higher primary patency at 1 year. However, secondary patency rates at 1 year and primary patency at 2 years were similar. These data warrant further prospective comparative studies to compare these two techniques, since percutaneous arteriovenous fistulas appear to have equal or in some way even superior outcomes than surgical arteriovenous fistulas. These were just 4 of the many excellent papers we published in the July issue of the Journal of Vascular Surgery. Please read our journals, follow us on social media, and send us great manuscripts for publication. Thank you for watching, and see you next time for the highlights of the August issue of the Journal of Vascular Surgery.